Every job has a purpose. Every career has a story. And every great business is built by passionate people. Mind your job.
This is episode 30 of Mind Your Job. And today we're going to be talking to Dr. Eric Block. But before we get into it with Dr. Block, I want to tell you I had a very interesting meeting this morning, sort of about the Painless book. And our book is being picked up by a couple institutions
So proud
for
of you.
people to, I know it's kind of cool.
So proud of you.
For people to have required reading. And I gave it to the person I met this morning who is a real estate person. And he was like blown away at just how much information doctors are not aware of when they're opening a practice, which kind of is our entree to today's guest, because we're going to learn a little bit more about like how people do things and open practices. And yeah, we're trying to shape shift people, that opening a dental practice just isn't about the things you think it is. There's so much more that goes into it that you are not learning in dental school. And we want to be a resource for people to help them not make mistakes in the future endeavor of opening a practice, because it can be costly. So take it away, Sam.
Well, hi and hello, doctor. It's so nice to meet you. So glad to have you here with us. I did a little bit of research about your background. And before we kind of get into, the nitty gritty of my questions for you, you have a very unique background. You've seen some things, you've gone through some things, and you are using your experiences to help guide, teach, and de-stress other dentists. Can you give a little bit of a background on that journey?
Yeah, let's do it. And congrats on the book.
We'll send you a
That's
copy.
I would
Text
love to
us
get
your
it.
address. Yeah, we're
Definitely.
sharing.
Yeah,
Sharing is caring.
it is. Yeah, I've written books, and there's a lot that goes into it. So I know the work that goes into it. So congrats on that. Yeah, I'll give you the blocky origin story. I'm in Massachusetts. I grew up north of Boston, and I ended up going to Tulane University undergrad. And one night I just missed my mouth and broke my number 9 central incisor on a beer bottle. And I was walking around with half a tooth that night. And the next day, I went to a local dentist. I went to Tulane and then went to the local dentist in Metairie, Louisiana. And I just loved the way they patched me up and gave me my smile back. And I said, hey, dentistry could be for me. So I took all of the prereq classes and the DATs. After I graduated, I graduated with a degree in psychology, but I had to take a year off and take all the rest of the prereqs. And
Right.
I applied and got into Nova Southeastern Dental School in Fort Lauderdale. And then after dental school, I did a 2-year residency at Boston University, which brought me back to Massachusetts. It was an implant residency. And then after that, I was off into the real world of dentistry. And about not quite, I'd say halfway through, maybe a little less than halfway through my career, I went through a tremendous amount of burnout and anger and regret towards dentistry. I thought I'd chosen the wrong profession. I thought there was something wrong with me. I was just exhausted from the day of giving my patient a great experience and then having to bebop into 5 hygiene rooms and give those patients a great experience. And uh, after 8 hours a day of doing that and just day in and day out of that social aspect of the profession, it was just wearing me down. And I got to a point where I thought about doing anything else other than dentistry. I thought about going to law school because I was so anxious about getting sued and so stressed
Oh,
about difficult confrontations with patients or staff. Um, but I knew that just leaving dentistry and starting over wasn't realistic. I was in a lot of debt at the time, $250,000 of debt. And I told myself, you've got to do something here to fix this problem because you can't not enjoy going to work every day and dread going into work and not be happy. And I picked up the phone and I called a local therapist and I started going through therapy, and it just changed everything for me. That with some prescribed medications, I was able to overcome my burnout and really figure out who I am and what made me tick, and why I was so anxious, why I was so stressed. And a lot of it was up here. It was me just being really just too hard on myself. I was a typical perfectionist dentist, and if something didn't go right, I would beat myself up inside. And I'm more introverted too, so the social aspect of the profession was really hard on me. But what I realized is there's nothing wrong with me. This is the way I'm wired, and I got to take care of myself before I can take care of
Sure.
others. So I just dug in and started taking care of myself, and I got back to the point where I love going into work every day. So wanted to share my story, and that's when I wrote my first book, The Stress-Free Dentist. I started the podcast, the Facebook group, and then from there, it just continued on to doing speeches and other books. And I just felt like if I could help other dental professionals going through what I went through, then it was all worth it.
Oh, go ahead.
I was going to say, well, for us, that's like why I started the company, Office and Practice Solutions, because I felt that dentists just don't get good information and nobody really points them in a direction where it's like, you're the practitioner, you have these people that work for you. You're not directing and leading them because you're busy doing production yourself. So you really don't have an eye on what's going on. And it is extremely stressful because nobody understands that if you don't show up, there's no production. And if you don't manage your people, they'll steal from you or not do their job, or you'll have an incredible amount of, staff slack off that you can't necessarily fix. And I think you just feel like, okay, I'm failing at everything. And I think for a lot of dentists that open their own practice, and I think that's what has sort of taken shape in the last 15 to 20 years with corporate dentistry is, why do I need to own a practice when I can go work for someone else and make a fair amount of money, and I don't have to be aggravated by employees that really aren't producing what I need them to produce, or I can't get them trained the way I want, or, the employee pool isn't always great, or the girl that doesn't answer the phone at the front desk, which means you're not getting the patient. All the things sort of happens. We did this to help people to be able to get through some of that.
And tied to that, doctor, I wanted to ask you. Um, there's so many different medical professionals out there, and one of the biggest things a patient will consider when deciding who to go to for a provider is bedside manner. And you'll hear from different types of doctors, oh, they're great, but their bedside manner is horrible, or they'll get the job done, but don't expect to be cared for with white gloves. They'll just tell you how it is. Why do you think dentists in particular try so hard to be on the people pleasing side of that spectrum?
Yeah, and that was me. I was a total people pleaser because, deep down inside, I just wanted to avoid confrontation. So I wanted everyone to like me. And you have people that are coming in the office. They're scared to be there. You have sharp things in their mouth. They have phobias. So we often will do whatever we can, to take care of our patients, and we leave ourselves in the dust.
Hmm.
But a lot of dental professionals, there was a path that we had when we went to school and in school, and then how to get your license out of school. There was certain classes you had to take. There were certain competencies you had to pass. Your state and national boards. There was a path in front of us. There was instructors to rely on. I had 99 other classmates to engage with. And then you get out in the real world and there is no path. Oftentimes we're in our
Right.
solo practitioner, we're in our own little bubble, and we're out in the real world and we didn't have any training. I graduated with the bare minimum clinical skills. I didn't know how to talk to patients, and I had no idea how to be a leader or run a business. Um, and we get our first taste of failure or mistakes or someone that's not happy with us. Going through school, a lot of us did great in school because if we didn't do well in that exam, we just studied harder and took it again. Well, when you're in the real world and you're dealing with real live patients, you can't just hit the redo button. So I think a lot of dentists will just, beat themselves up inside, and just try to make everyone like them on the outside. And that was absolutely me. Um, but as I got older, as I started going through therapy and life coaching, I just started getting more comfortable with myself and understanding who I am. And I no longer do that. I won't treat every patient or every case anymore. If it's out of my comfort zone, then I'll refer out or refer to a colleague, or I'll just say, no to the patient. That does come with, with experience and time, but I was an absolute people pleaser to start with.
But part of like, I feel like the whole patient journey for a lot of people is that like soft skill piece of it where you're able to like, I mean, I go to a guy, we all go to a dentist. I'm totally dental phobic and I do a lot of recruiting. And one of the things when I'm talking to someone on the phone is, can this person put a needle in my mouth? Can they put a drill in my mouth? Are they going to do, can I have an IPR strip thrown in between two teeth where they're filing without like jumping out of my skin or any of that stuff? And I think there's a lot to the soft skill thing that isn't taught in dental school. They're so worried about getting you to graduate or getting you to get your board passed that they forget about like, hello, the person in the chair, me over here. I'm afraid. You've got to talk me through the process here of like what you're doing to me and how you're doing it. The other part is even if you go work for a very large DSO or corporate dentistry, they will say are going to offer you mentorship. And I mean, we're recruiting people where they're like, I never got offered mentorship.
Right.
And so it's like a huge misnomer of like, one of the things you need to learn in dental school is patient facing, like just being able to talk to a patient about like, hey, tooth 14, we put a big filling in there and that filling doesn't look like it's going to hold so well in the next couple of months. We're going to need to put a crown on that tooth for you to, improve its ability so that you can chew food and not be miserable. And I think like just explaining that to people, it's hard for them to, and then you get the big, for you, your big opposition is, well, how much is that going to cost me? It shouldn't be how much is this going to cost you. It should be this is going to improve the quality of your ability to chew food and nourish yourself. Like the cost benefit for people has to be laid out to them and the health benefits at the same time.
Yeah, there's definitely a part of that is, when I first, and I think a lot of dentists may share the same feeling, is that when I first got out of school, I was just trying to get good clinically, and I was a hot mess. And patients feed off of your vibe, and if you're nervous and unsure of yourself, then they're going to feel that too. And same with the staff. And now I walk in, and I've been practicing dentistry for over 20 years. I'm much more confident. I'm calm. But I've been doing this for years. But when you first get out, you're just trying to figure yourself out. You have a lot of voices in your head telling you to pick, you pick this material, pick that material, use this burr, what's going on with this x-ray. So there's a lot to juggle there, and absolutely patients, they'll go by trust. If you can relate to them, I try to absolutely make a great connection with patients first. Talk to them about anything but dentistry. How's their family? How's their summer going? And then dive into diagnosis and treatment plan. But I'm much better than that. It's like a performance, like a Broadway show. I've gotten much better because I've gotten the reps. And but what I wish I had done, young Blocky, when he first got out of school, took every class he could on like bone grafting and implants and bonding agents and veneers. But going back in time, I wish I'd taken more classes on communication and leadership. And the beauty of now is there's so much out there on YouTube, and it's all free. You can find a a video on how to talk to patients. It's all out there now, which it wasn't back in my day. But it took me a while to get comfortable with myself, get good at clinical, learn how to talk to patients, learn how to educate them so that they'll move forward with treatment. And then the final piece to the puzzle was how to run a business and be a leader and staff management. That's a whole other thing that I had no training in.
So you've mentioned things that you didn't have or you wish you would have, and things that you've learned now, looking back, hindsight 2020. Looking at everything, what makes a good coach or mentor? What if someone said, "Oh, well, we offer mentorship," but what should that look like?
I think it's so individualized because some dentists early, if they're really early in their career, they need help with everything. Um, if it's I have young dentists call me and they hate doing crowns because they did crowns in school and they thought they'd be much better at it and quicker at it, and it's taking them 2.5 hours and they're not happy the way it comes out. So my coaching for them or mentorship for them would be, let's focus on what your biggest pain point is. What is your biggest headache right now? Is it crowns? Is it clinical? Let's get awesome at crowns. Is it that you can't get patients to accept treatment? Let's work on your verbiage. Is it that you're physically exhausted or your neck hurts or your staff hates each other and they're fighting and crying and your staff doesn't know how to answer the phone? Let's focus on that. So I think there's so many different things, but I think that for a coach or a mentor, um, really, and also the dentist themselves needs to look at themselves in the mirror and say, I need to really, first of all, to get help. I need to be coachable. I need to be able to accept mentorship. And this is what I need help with. And some mentors may be just good at teaching the clinical side. Others may be good at the practice management side. So I think absolutely having more than one mentor and one coach is the best way to go. But the dentist has to accept and look at themselves in the mirror and tell them they need help and be coachable too.
We have a client who literally, when we asked him, what are you looking for? And he goes, coachable, trainable, teachable. That's all I want. And I'm like, okay. And you can tell when we're doing interviewing, when I have to tell someone 14 times the same direction of like where we're going with the interview, I'm like,
Mhm.
they're never going to work. This culture is not going to help that person. And I think you're 1000% right. I think a lot of these people get done with dental school, and I'm not saying this to be mean or to deflate your ego or hurt your id or your super ego or any of the psychology things that are going on in the world. Will be a good listener. Stop thinking you know everything. You're at the tip of the iceberg. You are not into it as much as you think you are. And you may have been really good clinically, but once you get out, it's a whole different ballgame. It is, oh, I drilled into that tooth and now I have this person screaming in my chair, and I've got tooth 2 all prepped, ready to go. And I'm starting to drill crown prep and I got a root canal. And I'm not sure today I want to be doing a molar, upper maxillary molar on someone. So I'm going to send that out to, which endodontist am I sending it out to? I mean, all that stuff sort of like plays into it, and how you are able to shift gear into explaining to somebody that, oops, it didn't look so, it looked pretty good on the x-ray or the CBCT or whatever mechanism I was using to do my diagnostics. But when I got in there and started cleaning it up, it's a lot worse or a lot more infected than I thought. And now I think we have a root canal, not just a crown. It's being able to shift gears to that. And I don't think they teach that so great in dental school. And the other thing is, I'll ask someone like, how many root canals did you do clinically? I mean, I hear from people, oh, I did 1.5 root canals. I'm like, what's a half a root canal? Educate me.
Yeah.
Did you fill it? Did you do a pulpectomy? What did you do? So there's a big, huge disconnect between a dentist like yourself and the time you were trained, and even now how they're getting trained. I mean, you'd be amazed that it's slid since COVID drastically.
Yeah, I can't even imagine, the poor students that had to go through dental school in COVID. But I think it's also, it depends on the school, it depends on the student. Again, I did not come out of dental school confident. I knew I wasn't ready for the real world, and that's why I did another 2-year residency. And even after that, I was still, not ready for real world dentistry. Um, but you mentioned, coachable, being trainable. A lot of dentists, they do come out and there's an ego involved. I talk to a lot of my, colleagues, and I'm like, "Hey, how's it going?" And they're like, "Awesome, man. Everything's great. I'm super busy. Everything's awesome." And then I'm like, "Really? Like, how's everything going?" Like, "Good, man. Good." And then I get to the third question, "How you doing? How's everything going?" Like, "Oh man, this problem, this problem, this problem." So it's like you have to get through that outer layer. A lot of dentists put up this barrier that everything is great. And I think men are not good at this, but we suppress our emotions deep down inside. And I compare it to a volleyball under a pool. You push that volleyball under a pool, and eventually it's going to pop out, and it's going to burst out. So yeah, it's absolutely a journey. You gotta, look at yourself in the mirror, be coachable, listen, like you said, get many mentors, different kinds of mentors. And then very important is to not go through this journey alone regarding peers. You got to reach out to peers because dentistry is a very complex profession that a lot of people just don't understand, and no one will get it more than someone that's doing the exact same thing that you're doing on a day-to-day basis. So reach out to peers, and there's so many great groups out there now, and you can meet people live again at conferences. But uh, if you feel like there's just something not right, reach out for help. The sooner the better, because uh, unfortunately a lot of dentists wait until they've hit rock bottom, and that's sometimes that's too late. And we've all heard the statistics of suicide, depression, alcoholism, you name it. Dentists, it can happen if they let this profession run them over and they don't take care of themselves. So if you're out there and you're feeling the burn, you're feeling regretful towards the profession, you got to reach out for help, and do it sooner than later.
It's not, you can't sweep it under the rug, unfortunately.
No. I know that you have also done a lot to ease the burden of work of running the office, systems and processes and procedures. I saw an acronym come up quite a bit when I was doing some research, and it's FLOMO, FLOMO. What is that?
Flomo is a combo of words of workflow plus FOMO. And that's where me and my co-founder came up with the name of Flomo. And it's like an office manual on steroids. So
Okay.
my philosophy is, in my office, I do something once, I document it, and then I put it in the bank. I put it in Flomo. And it's a software that helps dental offices get organized with standard operating procedures, with documents, with policies, with protocols, clinical setups, scripts on
Uh-huh.
how to answer the phone. Everything is documented. So the goal, and I was just tired of repeating myself all day with the same questions. That gets exhausting. And then if you have new staff that comes in, training new staff can be difficult. Or if you have staff that's doing things their own way, this helps get everyone on the same page, and staff doesn't have to interrupt each other as much because they go to Flomo and they can look anything up. It's all under the search database, and I have different categories. I have clinical, I have hygiene categories, I have front desk, insurance, social media. Everything I do from the time you walk into the office and turn the lights on and the compressor on to the end of day checklist, and everything in between is all documented in my office.
Got it.
Do you um have people reaching out to you, sort of asking you about how you guys are doing things differently and how you overcame some of the things like you're talking about operationally, where it was just like repetitive processes, procedures, all that stuff? Do you have do you have a group or a study club or anything where people can like learn more about this or do anything with it besides the literary documents you have?
Yeah, so I have a Facebook group called the Stress-Free Dentist Facebook group. And then also I co-founded the International Academy of Dental Life Coaches, which is a place for dental professionals to go and get matched up with a life coach. Or uh, if a dentist or dental professional is looking to create a second career and become a coach, we have an awesome community of coaches that help dental professionals. So that's the International Academy of Dental Life Coaches. I'm on Facebook. I'm on LinkedIn. I have the Stress-Free Dentist podcast and group. And then Flomo, you can just look up useflomo.com, FLOMO. And we're doing webinars. We're trying to get content out there. We're trying to spread awareness. Dentists are a tough group to sell to. I get it. I am one. Because we'll just fight through the pain and do the same thing, over and over and over again, even if it's given us a huge headache or pain point. So changing behavior for dentists is very, very challenging. And I know that going into this, because dentists they get in their way, the way they've done things, or this is the way we've always done it, and they don't want to change. And change is very hard for people. They may fear their staff, changing something in the staff. So we help dentists that want to be helped. But it's not just the snap of a finger. You got to put the work in. It doesn't happen overnight. We do have templates in Flomo to help people get started. But just like we were talking about in coaching, pick your biggest pain points. Is it clinical, where your assistant doesn't know what burrs you like to use? Document that first. Is it that your staff doesn't know how to do insurance claims? Document that second. But yes, I have tons of people that reach out to me, and with different ways that I can help them.
It's not always just wanting the help or needing the help. Like you said, it's the consistency. Like, there's a statistic out there to like change operational leadership or operations within a company. I think it's like a 6-week cycle just for people to adapt it. And it takes 6 months for people to have it be like a second nature, second hand part of their regimen in their office. So anybody who's listening to this, I just want you guys to know, it does not happen. Not only does it not happen quick, but if you're not consistent with it, it will take you forever. You have to it's like a diet. You have to just make an agreement with yourself to try it for 6 months. If it doesn't get better, go back to the way things were or try something different. But if you try something for 6 months, something good will come out of it for you. I know that all of this change operationally is tricky, but you got to at least try it, because the alternative is a lot of emotional upheaval for you. It's not just the professional. It's you don't like going, like you said, you don't like going to your office. And I think a lot of people, even at the height of success, can get really stressed out because they don't have a consistent behavior for how they do things. They try, but they can't maintain it. So being able to do that is really important.
Yeah, there's a couple things you mentioned there. Now, operationally, if you have new staff, there's that whole onboarding process. But what if you have a temporary staff member that's in? They may just be there for a day. So I have a whole category just for temporary staff. So if it's a temporary hygienist, we give them our perio protocols. I have a whole document of who we are, what our practice philosophy is, who I am. Do we have a periodontist? What are our hours? Where photos of where the sterilization is, the back room. I want to try to make that temporary hygienist day as productive and efficient as possible. And then I also wrote about this in one of my books, the duality of dentistry, where on the clinical side, as dentists, we have to be so careful clinically. If we add a new treatment or a new technique, a few years ago, I started sleep apnea, or if you're just getting started with implants, say you have to get educated and get very well trained before you perform that procedure on a live human being. So it does take time, but when it comes to adding a new software, a new practice management protocol, a new marketing strategy, my philosophy is start quick. Start. Like you said, give it 6 weeks or 6 months. If it doesn't work out, at least you tried and you just move on and try something else. But if you're just stuck in the hamster wheel and doing the same thing over and over and over again, then your life and practice are not going to get better or improve.
It's not the definition of insanity. Doing the
The
Yeah,
same thing,
hamster
that's
wheel.
that's it.
doing the same thing
Yeah.
over, expecting a different result. Hmm.
Mhm.
I mean, it goes without saying. I think you and I try all different stuff, and the only way you learn is by failing, unfortunately. But
Absolutely.
not everything is a total failure. It's just you have to like take the time to go back and look at like, okay, what did I do? How did I do? Some of this was successful. We'll add that to what we're doing. Some of it was
Mhm.
a failure.
Oh, yeah.
We're going away from that.
Well, you know what FAIL stands for, don't you? Have you heard this one? Either first attempt in learning or further attempt in learning.
Love it.
My favorite saying is focus.
Well, well, that's, yes, I understand.
I had
It's
a
yin yang.
hygiene meeting a few weeks ago that was an absolute disaster. I had it in my head like this is going to be, this is how it's going to go down, and I was trying something new, and it just did not go over well. So I chalked that up to, all right, that one didn't work. Let's move on and try something else. But this profession is a marathon, not a sprint. There's a lot of ups and downs. There's good days. There's bad days. But ultimately, I'm so glad I stuck with dentistry, and I have a business, I have a practice, I'm part of the community. I get to, for me, going into work, I enjoy it. So it's I'm very happy that I got over my burnout and anxiety.
It's a beautiful story, doctor. It
Plus
really
you're
is.
plus you're helping people. I mean,
Right.
the coaching part of it is huge. And I'm going to let people know that sometimes one coach may not be the right coach for you. So if you're not feeling like you're making any gains, it's like the same thing with a
That's
therapist.
exactly what I was going to say.
You can try different people. Sometimes I always say, do two things at once. Do like a group thing, a Spears class, or even a study club, and do a coach. And maybe both of those things will be movement
Mhm.
for you on your journey to a better, happier, more successful time in your career.
I agree with you.
That's
Absolutely.
a great point where you may not hit it off with the coach the first time. You may need to find another one or even a third try. And there may be coaches that they have different niches and they're really good at this, where others are really good at that. For me, coaching and therapy, and for me, it'll be a lifelong thing that I do because, uh, I feel like I'm at a really good spot right now, but I always want to get 0.1% better. And to me, a lot of that journey has been just removing negativity from my head. And when you get a coach and you meet with peers and you have a great community around you and you keep negative people away from you, it just opens up so much space in your mind. And I'm so much more productive and happy in doing that. And I couldn't do that on my own.
Mhm.
Um, and you'll see this Patriots logo here, but Tom Brady, he
He
hired
says,
coaches. He didn't hire coaches to get 10% better. He hired coaches to get 0.1% better. So you may just be getting just started in your career and you need to get 50% better. But let's say you're a seasoned dentist and there's just something you're really struggling with or getting, anxious about, you could have a coach just help you with that one specific thing.
I will say, so Sari and I have each been in the recruiting industry for over 2 decades. So we have seen a lot and done a lot, but everything is new and we still need reminders for each other. This morning on the way to work, we talked to each other in the cars on the way to work. That's just how it goes. And I was telling Sari that, I was feeling a little dejected about a couple of things that happened. We're not selling copy paper. We're working with people, and it's a difficult job, but it's also rewarding. And I was saying to Sari, like, I'm a little bummed about X, Y, and Z. And Sari was like, yeah, but you have your health. You have healthy children. You're in a good marriage. things are, going to turn around and it's okay. Give it a half a day and you'll see other things will happen. And my point is just like you were saying about taking out the negative space. Again, I've been in this for years and years and I did know it, but I needed to hear it. So even Sari saying that the negativity doesn't have any room in your head today. You got more to do.
I used to suffer from that big time, and I would lay there in bed and I would just think of the one bad thing, the one negative thing that happened during the day, and I just couldn't shake it. I couldn't shake the day. And, after everything that I've been through and therapy and coaching, and I was able to get rid of that. And now I focus on the good things that happened. And it is so freeing, but
Oh my
um,
gosh.
you can easily get stuck in just focusing on the negative things.
Right.
And I think I'm going to wrap us up with like one thing. I think you as a person only see what's going on in a four-wall space. And being able to have somebody give you perspective of what could be or an idea or what other people are doing, like Dr. Block definitely has a perspective because you do different things and you're doing different parts of dentistry and stuff. And somebody else looking at what's going on in your situation and giving you advice,
Yeah.
listen to that person because people aren't telling you something to be the cheerleader for themselves. They're telling you something to help you get better. And I think
Mhm.
that for people, they just need to like be open minded. If you're going to try something, don't be defensive. Put the shield down. Let somebody else in. Let the light in. Let the air in. Let your body breathe from someone else's oxygen. I think that really helps people a lot to understand and grow. And in dentistry, it's one of the hardest professions out there, especially when you own your own practice, is so stressful. I mean, it's the first thing. What's your pain point? I mean, I have doctors that say, I keep losing hygienists. Do you think you're doing something? I have doctors say, I don't have enough new patients. Well, what's your marketing strategy? I have doctors saying, I can't get my front desk person to answer the phone when she knows I'm back here working on a patient. It's all these things. There are tactics to use to get better, but you have to be open minded to try it.
Mhm.
Mhm.
Yeah, good stuff.
Mhm. Absolutely. Just mind the advice that's coming to you.
Thank you, doctor.
Mhm.
Mind your
Thank you.
job.
Mind your job.